Well, rising prescription drug prices prompting one Wisconsin legislator to call the system rigged, forcing consumers like you to pay more.
And don't be fooled. Just because you have health insurance doesn't mean that you are not affected by this. Tonight, Fox 11 investigates. Mark Leland reports on how the cost adds up and what legislators are doing about it.
Whether it's the EpiPen to treat a life-threatening allergic reaction or a simple pill for pain, prices for prescription drugs are shooting up.
Where all of a sudden overnight you have a 100 or 300 or 1,000% increase in a drug.
Overall, it has an impact on the total cost of care, right?
It seems like it's a double-edged sword.
If you think lower-cost generic brands are the answer, think again.
Sometimes something that normally was 25 cents a pill is now $9, $10 a pill.
Christine Stacker is executive director of the Partnership Community Health Center in Menasha. Most of those seeking care at the center are on medical assistance through Badger Care or covered through the Affordable Care Act. And yet Stacker says the high costs of some drugs, even with insurance, are not affordable.
People do make choices all the time, and unfortunately it's very sad that they have to choose between things like their groceries or paying their rent or gas in their car to get to work or their medications.
The overall cost of the situation is definitely at crisis level.
Dr. Ashok Rai heads up Prevea Health in northeast Wisconsin. He says health care itself is very regulated. Prescription drugs, not so much.
How they sell the drug, how they price the drug, how they market the drug, which is a lot of cost right now, is not a regulated area.
Without regulations, Rai says pharmaceutical companies have been allowed to raise prices on a wide range of drugs over the last several years. Some have soared in price, others have gone up moderately.
Drug companies themselves are increasing prices of existing drugs.
John Toussaint is CEO of Catalyst, an Appleton-based company looking to improve the value of health care for consumers.
14 to 15 was a 12% increase in prescription drug costs, and 15 to 16 was a 9% increase, so that's significant.
And the problem is where you get your prescription drugs can play a big part in how much you or your insurance company is paying.
That is definitely true. Depending on what pharmacy you use, the prices can be very different.
In the Green Bay area, we wanted to know the cash price charged for the 6 most prescribed drugs. Not all pharmacies felt comfortable quoting specific costs since prescription drug prices can fluctuate day to day.
So to be fair, at a pharmacist's recommendation, we gathered cost information from GoodRx and WellRx, the leading online sources for prescription drug prices. These prices include any coupons or discounts offered by the various pharmacies and represent prices listed on February 1st. ShopGo Pharmacy had the best or second best cost for 5 of the 6 drugs. For the generic version of Nexium to treat gastroesophageal reflux disease, ShopGo's lowest price listed was just over $70. Walgreens up to $90, Walmart $131, and CVS $140. In all, there was a range of more than $70, twice the ShopGo price, for the same 30 tablets at 50 milligrams each. Fox 11 Investigates reached out to all 4 pharmacies to better understand the price discrepancies. ShopGo responded, stating, "ShopGo does everything we can to provide great savings for our customers, including securing low drug costs and partnering in generic drug savings programs." Walgreens also mentioned its drug savings program and added, "When choosing a pharmacy, we encourage patients to select one based on overall pricing and the services available." And Walgreens suggested it's also important for patients to use a single pharmacy so pharmacists can monitor their medications and avoid potential drug interactions. CVS responded, pointing out prescription drug price surveys do not accurately reflect what the vast majority of Americans pay for their prescriptions. Approximately 98% of our pharmacy business is covered by third-party prescription insurance, in which customers pay only a copay, not the full price for their prescriptions. Fox 11 Investigates acknowledges the claim that most consumers are covered by insurance, which picks up the majority of the prescription costs at any given pharmacy.
It may be only $16 at the window, but it's a lot more on the insurance side.
Rai says the result of overall higher prices for drugs is ultimately higher insurance premium costs.
But it's really all of us that are paying more.
Yeah, and that's why I do refer to this as a national crisis, and it needs to be addressed.
Wisconsin Senator Tammy Baldwin introduced bipartisan legislation last year calling for more transparency and detailed accountability on the part of the drug companies. Her plan calls for drug companies looking to raise prices on any given drug more than 10% to give advance warning and explanation for the price hike.
This should never happen in America, and it is deeply disturbing to me. And we have got to take action. This should be one of several strategies we use to bring drug prices down.
Rise supports the Fair Drug Pricing Act, but says overregulation by Congress can also hurt.
Some of the regulation that creates the excess cost actually exists within the federal government.
Such is the case with current law that doesn't allow the government to negotiate the best drug prices for Medicare.
It would seem the federal government made rules that in essence is just costing taxpayers more money.
You know, that's what disturbs me. I think it's just another example of the system being rigged and the powerful interests coming in and writing their own rules that advantage them.
Baldwin supports current legislation to remove the Medicare negotiating provision.
What does the legislature need to do?
I think as a country as a whole, we have to get a handle on the rising costs of health care.
But as Congress looks for answers to combat higher drug prices and explores changes to the health care system, the problems continue. For Fox 11 Investigates, I'm Mark Leland.
To see current cash prices posted for any prescription drug at the different pharmacies in your area, we have links attached to this story. You can check that